the crisis of 2013, December 2013, like the trigger, it just flared everything up. So the decompensated personality that had been through a war for the 21 years that started to compensate, then they all break down after December 2013. That's why we have an increasing number of patients, we have increasing number of violence, we have increasing number of drug and substance abuse. Things are going differently. They are now having clear symptoms of PTSD. Some of them are increasing to self-medicate themselves. So for me, December 2013 was a turning point. When I came here, as we all know, that mental health service in South Sudan is almost leveling zero. We don't have clinicians by that time. Now we are two, me and Dr. Mohammed Boy. Within the country, we are having two problems. Alcohol and substance abuse, the main presenting problems. Either there is an increased rate of depression or there is an increased rate of post-traumatic stress disorder, because both two, they try to self-medicate themselves by taking alcohol. And we are having psychosis with different varieties, ranging from schizophrenia to depression and psychosis. We're having two ways of approaching things. We're having the long-term plan for the country, because we have to build a continuous medical services. And I'm having the emergency plan for those who are already sick and those who are already need to be treated by the time. The long-term plan is concerning about training more professionals, building facilities, setting a policy, setting protocols. And this is, honestly, it's going very slowly because I'm not concentrating on it. I'm concentrating on my emergency plan. I'm now starting training community health workers. They are normal people from within different communities, because we have over 64 tribes in South Sudan, so we need different people that talk their language. So we train them how to identify, how to assess a mental ill case, how to identify the diseases, and how to interfere and when to refer. Then we are having the secondary care level, where we are training the states. In the state's hospital, we are training the medical doctors. The major problems that we're now having within the level is the issue of budgeting, because people doesn't like to invest in mental health. As we all know, it's the neglected aspect of health in the whole world. So we're having problem with the influx of medicine. We're trying to do this with some of our partners, but we need something sustainable. The other thing is the mobile clinic need to be kept mobile, because it doesn't make sense if we are not moving. So we train like 12 community health workers. They are now working within the IDP camps around Juba. They are within the IDP camp, so they are staying there already. So we just bring them for 2 weeks training. Then every 2 to 3 months, we bring them for a refreshing course. They are doing great jobs, because they are now our eyes in that IDP camps. So they are covering most of it. So for me, we need to increase it, because it's a 12 community health workers for Central Equatorial State, not even for Greater Equatoria. We had done no work for Greater Barakazal and no work for Greater Upper Nile. That's why for me, I want to train more community health workers. We need more of them, because for me now they are cornerstone of doing everything. So because they can go to every corner of the country, then they will be like my eyes in that place.